Hi, Mike. I'm Dr. Mackey. I'm with Mercy Fort Smith, and I actually saw the first patient in the entire ministry who tested positive with the multi-cancer early detection test, Galleri, back in August of 2022. And so I understand that you also had the test performed. You had a positive signal. Can you tell me about what that was like, the whole process, what happened exactly to bring you to that point?
My girlfriend was retiring from being a school principal, and she had some money left over in one of her tax advantage plans. She was a triathlete, in really good shape. And she went and took the test, and it came back fine. She goes, "Why don't you go take the test?" I called Mercy up. They scheduled me in for the following Monday, went in there to their lab. They drew blood, 15 minutes at all, it took at the most. Following week, I got a call from a nurse at Mercy who said, "We've got a positive," and the cancer signal was in my head or neck. I said, "Okay, all right, let's deal with this." I was in good health. I went to the YMCA 5 to 7 days a week. I was in good shape. I felt fine. 7 or 8 more days after that, I had a CT scan scheduled on a Wednesday, a PET scan on a Thursday, and on Friday I saw a doctor by the name of James Martin, who was an ear, nose, and throat cancer doctor at Mercy, and he looked down my throat and he goes, "You got tonsil cancer." I was diagnosed with stage 2 tonsil cancer. It was in my right tonsil.
No symptoms?
No symptoms at all.
No symptoms?
No sore throat, no cough. He took a biopsy, 2 of them actually, and they sent those off, and they came back, confirming what he had said. The following week, I went in and met with a Dr. Sean who was the chemotherapy oncologist. And every Wednesday we had chemotherapy, and then every day of the week until August the 10th, I had radiation Monday through Friday.
That's an amazing story. You have the test before you have any symptoms. To catch something early like that is rather amazing.
Yeah, that's the thing that just amazed me is I had absolutely 0 symptoms. Like, I got a colonoscopy every 5 years. I got a mole check every year. I get the prostate checked every year. But it was just like I had never any idea whatsoever that I'd been sick.
So what do you think about your experience with the care coordination? What was it like at Mercy?
It was very smooth. Everybody was helping me. People were calling me on the telephone. I was, saying, "You need to make an appointment for this. You need to make an appointment for this." I was very impressed. It's perfect. Yeah, no complaints whatsoever. I even went to the point of calling a couple of competitors of Mercy to see, can you treat me faster? They couldn't.
Along the same lines, what can give you the kind of confidence you need in a physician or a medical care team?
It's basically everything being organized and coordinated. When you go there, exactly. Everybody tells you exactly what they're going to do, when they're going to do it, how long it's going to last, and it was just like everything was very well organized.
In the case of the GRAIL Galleri test, what has been your approach and talking with friends and family about this experience?
Anybody who can take this test ought to go take it. It's just a simple blood test. Your investment in time is like 10 minutes talking on the telephone one day and another 15 minutes getting the test. There's hardly any investment in time, a little bit of investment in money, but it's money well spent.
After I saw my patient, I got my own test done, so I know what you're talking about.
What's going on with Mercy with regard to, offering this test to people?
That's a great question. We live in an exciting era. I've been in practice for over 20 years. Mercy is taking the approach of precision-based medicine to guide our treatment recommendations to improve quality in the care that we provide our patients. And it's just amazing to see that we have, the technology exists. For the past 20 years, I've been asking myself, was there something that could have been done to, find this particular cancer sooner? Obviously, you got, mammograms for breast cancer, you got colonoscopies for colon cancer, you got pap smears for cervical cancer, but there's not a lot of, other screening tests for other unusual types of cancers, like, for example, head and neck cancer in your case. So this opens a whole new frontier where we might have more treatment options. The goal, obviously, is to find it as early as possible, and then the next step is, well, maybe cure it if you can find it at the earliest stage possible. So that's one of the reasons why Mercy has been taking the approach of precision-based medicine to guide our treatment recommendations.
You see, It was great. It was the simplest, one of the simplest tests I've ever taken in my life, and I'm just so happy.
Based on a clinical study of people ages 50 to 79, around 1% are expected to receive a cancer signal detected result, which includes predicted cancer signal origins. After diagnostic evaluation, around 40% of people are expected to have a confirmed cancer diagnosis. The Galleri test is prescription only. The Galleri test is recommended for use in adults with an elevated risk for cancer, such as those age 50 or older. It is not recommended for individuals who are pregnant, 21 years or younger, or undergoing active cancer treatment. Galleri should be used in addition to routine cancer screening. Galleri does not detect a signal for all cancers. False positive and false negative results do occur.